Hi, this is Sarah Mikesell with the Pig Site, and today we're here with Dr. Paul Yeske. He is a veterinarian with Swine Vet Center. Thanks for being with us today, Paul.
It's my pleasure to be with you.
Very good. And today we're going to talk about soy, which is a little different topic than you and I think have ever talked about. So this will be fun. Can you start with a brief description of your presentation earlier today here at the AASV meeting?
Sure. Today I was talking on soybean meal as a tactical ingredient and how we can use soybean meal in maybe a little different way than what we've typically thought about when we think about soybean meal. And it was interesting that in one of the early in a study that happened a few years earlier, where they were looking at the different levels of lysine and whether it was high or low soybean meal, they had a respiratory disease challenge. And what they saw in the respiratory disease challenge was that the pigs on the higher soybean meal content diets performed better. They had better average daily gain. And so they thought that was interesting, and then they've gone on to do some more work looking at, could that possibly be a real finding, or was it just something that happened?
Very good. And is this some of the first research then that demonstrates this mitigating effect on respiratory disease?
Yeah, I believe that it is. Dean Boyd and their group at Hanover back in 2010 had the study where the respiratory disease broke, and they had the opportunity to take a look at this. And some others have followed up with additional studies showing the same effect. And so, again, it's not necessarily new work, but it hasn't really seen a lot of publications so far. And just trying to get that word out a little bit more, that's something to consider.
Very good. Well, you shared a lot of data, so there is a lot of data to look at. We know that, right?
Yes, absolutely. And again, looking at trying to understand what's the piece or what's the mechanism.
Right.
And I'm not sure we fully understand what the mechanism is yet today, but what they looked at was to say, was it the soybean meal high or low? Was it the lysine levels, because they did multiple different lysine levels? And what they found was the soybean meal was the greater impact necessarily than the lysine. Both had an impact, but the soybean level of soybean meal was first in the hierarchy versus the lysine level. And so, again, showing that was part of the performance. The other side of the coin was some of the other compounds that are in soybean meal that we don't necessarily really understand well, is some of the isoflavones and some of the other biopeptides that are there, and some that are generated in the digestive processes. And so all those things could be playing roles here, but certainly identifying a correlation there with reduction or mitigation of some of the impact of respiratory disease.
Cool. Very good. In the presentation, you mentioned the hidden cost of SRD. Tell us more about that concept.
Yeah, and I think it came out of this first study is the group really didn't understand what the impact of respiratory disease, and I think sometimes it is it's undervalued of what the impact has been. I've spent a lot of time working with PRRS and Mycoplasma over the years, and certainly one of the things we've seen as we've been able to eliminate these diseases is we've seen better average daily gain and better feed conversion, and that's what they were able to see here is better average daily gain and better average feed conversion. So again, doing some of those same effects as when we remove the pathogens and being able to mitigate some of those effects.
Excellent. Can you tell us more about what is meant by soybean meal as a tactical or prescriptive ingredient in mitigating the severe effects of swine respiratory disease?
And I think it's somewhat thinking about it more like we would think about our traditional treatments, that it's more of a prescription. Is I've got a respiratory health challenge in my flow or my pigs, and so it's something I can prescribe or use as a tactical advantage to try and help those pigs through that challenge. And so really what you're trying to do is just set up a better environment for that pig to perform.
So not necessarily something you do all the time, but maybe if a need arises.
Yeah, absolutely. And that's where the diagnostics become very important in understanding what's happening and if it's time to deploy or not.
Very good. Do producers understand their prevalence and what agents their herds are dealing with within the SRD complex?
I think it's a challenge. Certainly, there's different levels of understanding. And so I think the key comes back to having a good diagnostic profile and understanding what agents you're dealing with. Is it PRRS? Is it Mycoplasma? And understanding when those organisms are being active in the herd. And so we can do some things such as profiling the herds, looking at some serology over time, whether we do it as a cross-section in one day, looking at multiple ages, or whether we follow a group over time through the finishing phases and try and understand where those pathogens are being active and how we might do some different changes and at what times that might be important.
Right, a little bit more research needed, it sounds like.
Yep.
So, how could producers evaluate soybean meal as a prescriptive solution to reducing SRD-related losses? You talked about this in the presentation. Yep. For sure.
Yeah, so again, doing their own trials is always the best.
Right.
Because every pigs are a little different, every health status is a little different, the organism levels are a little different, and so if you can do the research, certainly having some research that says that there's an advantage out there is helpful, and then seeing how much there really is in your particular production flow. If you make the changes, what's the impact going to be, and does it return what we're thinking? Can we get that better average daily gain? Can we get that better feed conversion? And does it pay for itself at the end of the day? And so whether you have access to a research barn, that's always the best because you get multiple reps. Right. And when we do them barn to barn, we can do them barn to barn. It's a little more dirty. It's a lot more background noise when we look at the data and you're looking at whole closeout data. So it's, again, sometimes some of the advantages can be lost in the noise of the data. And not that it's not real, just we didn't pick it up.
Right. But you'd want to be doing that trial when you have a challenge, right? Yeah,
absolutely. That's where knowing your diagnostics, knowing where your flow's at, and determining when should I take a look at this. And with the time of the year we're in right now, unfortunately, we're coming through PRRS season. And so as we came through December and January, we had more herds turn PRRS positive. So that tells us we're getting some more PRRS positive flows out there, and they'll be getting out into the wean to finish phase. And so that's the opportunity to take a look at it and say, is this something that we can do to help ourselves? It may not be perfect, but can we help ourselves?
And so what is different between soybean meal compared to other feed ingredients?
Yeah, soybean meal, at least myself, I always thought about it as an amino acid source. And again, hadn't really thought of it as a quote-unquote tactical ingredient or an ingredient I could use for respiratory disease. But looking at this data, I think it's certainly promising, and I think it's something that herds need to consider, particularly if you've had an active PRRS break or if you've got a PRRS and mycopositive flow and you're having some activity. It's certainly a good thing to look at and consider if that's going to make a difference.
Very good. Are there interactions between these functional bioactive compounds and the pig immune system?
Yeah, the isoflavones, some of the work at the University of Illinois showed that when we put those back in, we got better performance. And so when they had soybean meal without them and when they put them back in, they were able to reduce the mortality significantly in a PRRS challenge pig. So I was looking at PRRS challenge, so certainly a little bit more than what we might see in the field per se. But definitely given the opportunity to take a look at that and show that that's probably part of what's going on there.
Very good. And Paul, before we wrap up, what are the key takeaways you want our listeners and particularly your veterinarian colleagues to understand about this topic?
I think it's something to consider that we may not have considered in the past, particularly myself anyway, to say, is this something that could be helpful? And when we get stuck into these situations where we have some of these active health challenges, respiratory challenges, is this another tool we can do to help mitigate or reduce some of the effect? It's probably not going to make it perfect, but it's going to help reduce it and get more back to where we'd like to be for performance. And so, again, you've got to understand what you've got do the diagnostics, understand what you've got for health challenges, and then take a look at where it makes sense to deploy these tactical ingredients and when we could use those to our advantage.
Very good. Well, thank you so much for all the information. I really appreciate it today.
Thanks for having me, and happy to do it.
Very good. This is Sarah Mikesell with the Pig Site, and this information has been brought to you by US Soy.